Hi, and welcome to your first day at Synergy Home Care. I'm Nurse Corey, and we're going to be reviewing the clinical section of your employee handbook. Please join me on page 11. As a caregiver for Synergy Home Care, you'll perform non-medical duties such as activities of daily living, personal care, dressing, grooming, and bathing, and instrumental activities of daily living like shopping, housework, meal preparation, among other duties. Prior to your assignment for your new client, it's mandatory that you read their plan of care, which will explain which particular activities your client is expecting you to do when you arrive. During your shift or after, you'll record exactly what you did do for the client on your timesheet, and this information is very important. It is needed and reviewed by the nurse and other professionals. If you feel the plan of care does not adequately reflect the needs of the client, or if your client has had a change in their condition or requests changes to their plan of care or the activities you do for them, then just reach out to the office. And remember, always operate within your scope of practice. Companion caregivers may not provide hands-on care, and CNAs, HHAs, and PCAs can provide hands-on care assistance, but not skilled nursing care. If you have questions related to the activities your client wants you to perform during your shift, just reach out to the office and ask to speak to the nurse. Hand washing and standard contact precautions are mandatory for all client contact. Wash your hands on arrival to the client's home and make sure your client sees you washing for at least 20 seconds. You can use soap and water or an alcohol-based hand sanitizer. And remember to wash again before and after any client contact, eating, drinking, serving food and beverages. Standard contact precautions should be utilized for any time you believe you're going to come in contact with body fluids. Barriers such as gloves, gowns, and shields are for your protection, but do not eliminate the need for hand washing. Typically, you'll only need gloves to provide hands-on contact with the clients or their soiled linens, but additional PPE can be provided as needed. The clients will provide all the medical supplies needed for their care, such as their gloves, wipes, diapers, etc., and if supplies are inadequate, notify the office immediately. Synergy Home Care has robust COVID-19 training and policies. Be sure to familiarize yourself with these as you are responsible for knowing the COVID-19 policies and following them exactly. Our illness and call-out policy states that it's mandatory you call out and do not go to work if you're sick, especially if you're having symptoms of COVID-19. Likewise, if you have had any exposure to any person that has symptoms or has tested positive for COVID-19, you must call off from work and report that you've had an exposure. It's mandatory to take your temperature just before work. If your temperature is above 100, you must call out for work by calling the office number. Some, but not all, the symptoms of COVID-19 are fever, chills, cough, sore throat, diarrhea, loss of taste or smell, muscle or body aches, headache, fatigue, shortness of breath, congestion, and runny nose. And if you have any other symptom that concerns you, go ahead and call it in. Remember, you can experience only one of these, another type of symptom, or no symptoms at all, and still be able to spread the coronavirus. Even if you think your symptoms are an allergy or just a mild cold, you still must call out or receive permission from our nurse to return to work. Synergy Home Care nurses are available to employees for screening of illness and guidance for seeking care. Let's talk more about what exposure to COVID-19 means. Exposure is if you have been within 6 feet of any person who's having symptoms of the COVID-19 virus or they've tested positive for the illness. In this case, you need to notify the office because you are now at high risk for being infected, and our nurse will inform you what actions to take before returning to work. You'll be paid for sick leave or quarantine leave, and the nurse will determine if you need a test, and if you do need that test, Synergy Home Care will arrange it for you at no cost to you, regardless of whether you have insurance or not. Remember, if our nurse places you on sick leave or quarantine leave, you will be paid and you may not work while you're waiting on the test results of a COVID-19 test you've received. Caregivers who go to work with COVID-19 symptoms or a known exposure and risk infecting our clients will be fired. Surgical masks properly worn over your nose and mouth are required 100% of the time while you're on duty with Synergy Home Care clients, particularly when you are within 6 feet of a client. Clients cannot give you permission to avoid this requirement. For break periods, such as to drink water, caregivers are to move away from the client as far as is practical, a minimum of 6 feet before lowering their masks. Synergy Home Care has a supply of surgical masks for you. Contact the office to get a fresh supply and do not use fabric face coverings or masks from home. Synergy Home Care employees can only work in one facility or in client homes, not both. Employees must inform Synergy Home Care if you have another job working in a senior care facility, hospital, or other healthcare setting. Synergy Home Care follows a case-by-case designed, transparent clinical protocol with regard to transitioning employees between facilities or from a facility to a home-based setting. Contact the office for details and/or clarification on this process. Synergy Home Care has COVID-19 testing capability and tests employees when indicated by a report of a symptom or an exposure to COVID-19. You may be asked to submit to a COVID-19 test in order to protect the health and safety of you and your client. You must comply or you are ineligible to continue working. At the client's request and cost, Synergy Home Care can test caregivers for COVID-19 prior to starting a new assignment in the home and sometimes for facility work. Synergy Home Care does not provide service for clients with known or suspected COVID-19 illness. However, in the event a client becomes symptomatic while Synergy Home Care caregivers are on duty, appropriate protective equipment, emergency PPE kits, are provided and kept in client homes for caregiver use. Caregivers have access to training on this equipment. Now let's talk about one of the most common care plan activities, meal preparation and nutritional concerns. Be sure to follow proper food handling procedures when you're preparing nutritious, well-balanced meals that meet your client's dietary needs, which are outlined in their plan of care. And wash your hands before preparing meals. Encourage your client to eat healthy foods that are appropriate for them. Take into consideration if they have dentures or swallowing issues that might make chewing or swallowing difficult, and the diet outlined in their plan of care is very important to follow. If you need suggestions about meal planning or recipes, reach out to the office for ideas. Hydration is so important to your client's health. The thirst response decreases with age, so when caring for an elderly client, it's important to encourage them to drink water and other fluids throughout the day. Always keep a fresh glass of water within reach of your client and encourage them to drink it unless the care plan calls for a fluid restriction. Identifying and reporting changes of condition is one of the most important duties you have as a care provider. Report any significant physical, mental, and/or emotional change that has occurred with your client to the office by telephone immediately. Timely communication to the office is important so that we can review, take any action necessary, and follow up. If you're not sure if your client's change of condition is significant, just notify the office so that we can assist you in assessing the situation. This duty is a very important part of your job, and failure to report a change of condition in a timely manner can result in your removal from assignment, suspension, and/or termination. All changes in client condition must be documented in the ERSP Mobile Connect app under the comment section, or if using paper, the Synergy Home Care Caregiver Communication Form. Communication is a key element in providing care to the clients we serve. Communication with the client, family members, and other responsible parties is important in order for you and the client to determine what needs to be done or any changes in condition. Open communication with the office is also important in order to discuss changes in scheduling and the client's condition. Your communications are a reflection of our company and industry as a whole. Written and verbal communications are important and required. It's mandatory that you call and speak to a member of the office staff for any urgent concerns regarding yourself or your client. Remember, when you're speaking with clients, to keep communications professional and client-centered. We never want to burden a client with our personal information, such as financial problems, childcare issues, worries about our schedule, commute, transportation, or parking. Our office staff is willing and available to address concerns you have, and when possible, direct you to resources or make suggestions if you're experiencing challenges that affect your employment. If you have concerns about your client, a client's family member, your working conditions, other caregivers, or anything, pick up the phone and call the office to report your concern. Our office staff will investigate your concern and take any action necessary. When you accept an assignment on a 24-hour case, you agree that you will never leave the client unattended. That means if your relief caregiver is running late or has a last-minute call-off due to an emergency, you must stay with the client until we get another caregiver there. So arrive about 10 minutes early for these assignments so that you can be briefed in detail by the off-going caregiver and you'll be familiar with the client's current condition and status of care. Likewise, when your assignment is about to end and your relief caregiver is about to arrive, be ready to give them a detailed report on everything that happened during your shift, the client's current condition and needs. Make sure to document detailed care notes on everything that happened in your shift, both on your timesheet and in many cases there will be a binder in the home where you can write notes on what went on during the 12-hour period for which you were with the client. Anytime you feel you're faced with a true emergency while on duty with your client, such as you think they might be having a stroke, a heart attack, or they're injured, when you notice a sudden change in your client's behavior, speech pattern, breathing, consciousness, or they've fallen, call 911. If the 911 dispatcher decides it's necessary, they'll send out assistance. And once you're off the phone with emergency services, call the office immediately. The office can then notify the client's emergency contact persons. Falls are an unfortunate but common emergency for seniors. If your client falls, do not move them. Assess the situation for a serious injury, and if they're injured, dial 911. If the client can move around without pain, have them start to move slowly, moving their arms and legs and trying to get up off of the floor on their own if you believe it's safe for them to do so, or with just minimal assistance from you. But never lift a client up off the floor. If the client's unable to get off the floor without just minimal assistance from you, then call 911 and have them assess the situation because your client may be injured and you do not want to risk injuring them further or injuring yourself. Do not seek help from a neighbor, friend, or family member to lift the client off the floor, even if they ask you to do so. Remember, our policy is that if the client cannot get up without very minimal assistance from you, to call 911 so that they can assess if your client needs further assistance. Even if the client resists and tells you not to call 911, you need to remind them that that is our policy. Calling 911 does not mean that the client must go to the hospital. Every person has a right to refuse to go to the hospital if they want to. However, your client needs to refuse this assistance to the emergency responders. Do not make this your liability or make this decision on your own, as we do not have the authority to do so. Explain this to your client, and if the client agrees to go to the hospital, please accompany them there, and Synergy Home Care will provide you a ride back to your car. Call the office periodically to let us know what's going on with the situation, and as soon as possible, you'll write an incident report describing the date, the time, the place, who was involved, and all the details of the event of a fall. If your client falls in a facility, you'll have other staff members to help you. Call for a nurse by using the call button or opening the door and asking for assistance from the personnel. Let them know your client has fallen and you need a nurse. Wait with your client until that nurse arrives and keep them calm and still. When assistance arrives, let the facility staff take control of the situation and follow its protocol. It may still be necessary to call 911. Do not delay calling 911 if you know that your client has had a severe emergency. When assistance has arrived and you can step away, remember to call the office to report the fall. Never assist with lifting a client up off the floor unless a nurse or a doctor has authorized you to do so. Only a nurse or doctor is qualified to assess the client for possible injury and determine if it's safe to lift them up off the floor. If someone other than a nurse asks you for assistance in lifting someone off the floor, refuse and tell the facility staff that that is not safe. Tell them they need to call 911 or the non-emergency number for assistance. If the client is injured or in pain, they must be assessed by a licensed medical professional, a nurse or a doctor. If there's no licensed medical professional on duty at that facility, then insist the facility staff call 911. Call the office with any updates, especially if the facility refuses to call 911, and as soon as possible, write an incident report. And you may also be required to write an incident report for the facility. That would be requested by their facility nurse, and that's a good thing to do. Many clients have advance directives, especially if they're adult terminally ill clients. Legal documents, including a living will and medical power of attorney for healthcare, enables individuals to indicate their wishes about medical treatment and end-of-life decisions in case they are medically or mentally incapacitated when these decisions need to be made. These documents may include a durable power of attorney that allows a designated person to make financial and legal decisions for someone who is unable to do so themselves. Synergy Home Care conducts home assessments for new clients to determine if these services are needed, and at the time of assessment, advance directives are discussed with the client. If the client reports that they have an advance directive and/or a do not resuscitate order, the caregiver will be informed in the plan of care. The service plan will include the client's emergency contact information and if a DNR exists. If a client has a DNR, it's an official DNR form that should be posted in the home and accessible for emergencies. If you cannot locate the DNR form, even if there's no emergency, contact the office immediately so that we can locate it, because in the event there is an emergency and EMTs come to the home, it's the caregiver's responsibility to show the EMTs the DNR form. DNR means do not resuscitate. That means you would never perform CPR on a client with a do not resuscitate order. Remember that do not resuscitate does not mean do not treat. Do not resuscitate simply means that if your client passes away, as in they're no longer breathing or their heart has stopped, we would not perform CPR. But if they're having some sort of a medical problem, they should still get treatment. So for emergencies, continue to call 911. Notify the office for other changes of condition so that we can notify their emergency contact people and make arrangements for them to be seen by their physician. Sit with your client, keep them calm and comfortable, notify the office, wait with them until paramedics have arrived, and let the office know about the outcome of their emergency. Synergy Home Care is committed to maintaining a workplace free from discrimination. In keeping with this commitment, Synergy Home Care will not tolerate unlawful harassment of any of its employees, including harassment based on race, color, sex, pregnancy, sexual orientation, national origin, ancestry, religion, age, disability, marital status, or any other basis, status, or characteristic protected under local, state, or federal law. Any employee who believes that he or she has been subjected to unlawful harassment should immediately report the incident to a staff member that they trust. Synergy Home Care prohibits retaliation against anyone for reporting harassment and will assist in investigation of a harassment complaint. It is company policy to maintain confidentiality of those involved in the investigation. If the outcome of the investigation confirms harassment has occurred, Synergy Home Care will take appropriate corrective action, including disciplinary action up to and including termination. Abuse, neglect, and exploitation must always be reported. Please refer to pages 17 through 19 of the Employee Handbook and read them through. It is important that you report any suspected sign of abuse, neglect, or exploitation. There's different forms of abuse and neglect. It can be passive or active. There's sexual abuse, physical abuse, material and financial abuse, psychological abuse, and violation of human rights. If you suspect that any type of an abuse or neglectful situation is occurring with your client, then you must notify Synergy Home Care Office as soon as it is safe for you to do so. Scams are another concern for our clients. Seniors are at high risk for financial victimization. Protect your clients and yourself by keeping the following in mind. Don't be pressured to act immediately. Scammers will typically try to make you think you have to do something right now. It's never a good decision to make an important decision right away. Tell them you'll call them back. Never share personal information like the credit card number, social security number, bank account. And if you hear your client doing so over the phone, try to interrupt them and ask if they can call the person back, especially if this was an unsolicited call. A legitimate business will not call you unsolicited asking for this information that they should already have. Never send money to someone you have not met face to face. Seriously, just don't do it. And really don't do it if they're asking you to use a wire transfer, a prepaid debit card, or a gift card. Those cannot be traced and are as good as cash, and once they're gone, good as gone. Don't click on links or open attachments in unsolicited email. Links can download malware onto your computer or your client's computer and steal your personal information. Don't believe everything you see. Scammers are great at mimicking official seals, fonts, and other details. Just because a website or email looks official doesn't mean that it is, and even caller ID can be faked. Be cautious about what you and your clients are sharing on social media, and consider not putting out information such as that they're leaving the house. That can let the criminals know they're going to be gone, and imposters can get information off of social media and target people. Remember, if you think that your client has been victimized by a scam or you've witnessed them giving out information that maybe they shouldn't have, let the office know right away. There's a chance that by contacting their emergency contacts, we can still stop the victimization before it occurs. Caregivers are responsible for ensuring that the client's home is a safe environment. While providing care to your client, take a look around and check on things regularly. If you find something hazardous, broken, or that needs to be fixed, notify the office so that we can assist. Look out for trip hazards. Keep emergency phone numbers nearby and check the smoke detectors. If the battery is run low, try to replace it. If you're not able to, let the office know. Take a look around in the client's kitchen, living room, family room, bathroom, and bedrooms, and notify us if there's something going on with the electric, with the plumbing, or in another area that the home needs attention. Back to the kitchen. Remember, garbage disposals, you can never put certain things in a garbage disposal. The majority of food scraps need to be disposed of into the garbage can. Do not ever put potato peels or other fibrous stalks, fruit peels, pits, eggshells, coffee grounds, rice, pasta, bones, non-food items, or any oil, fat, butter, or cooking grease into the sink or garbage disposal. Put that in the trash and use cold water when running a disposal. Scrape the majority of food scraps into the trash. Disposals are only meant for tiny bits of food and not full portions of disposable leftovers. Put hot cooking oil into a tin or glass jar and dispose of that in the trash after it's cooled. In the bathroom, never ever flush wipes or anything other than toilet paper. Feminine care products, paper towels, napkins, even if the wipe says flushable, these will cause a plumbing issue and clog the toilet. If you see anything else going on in your client's home that needs attention, please report it to the office. Before there's an emergency, ensure that you know how you and your client will escape in the event of an emergency, like a fire. Make sure doors are not locked, clients are not locked in, and that you know your way out of the building and how you will get yourself and your client out in the event of an emergency. All clients and caregivers at Synergy Home Care are treated with dignity and respect. Remember to protect your client's confidentiality and privacy, and do not give out personal information to those who should not have it. Report any concerns you have about the client care to the office, and protect your client's rights. They have the right to choose what they want done day to day and how they want things done in their home. The caregiver must meet the client's reasonable requests, and if you have a doubt as to whether something is appropriate or part of the plan of care, contact the office for clarification. Sometimes misunderstandings arise out of differences in culture. Culture is learned and shared in families and in the community. For example, behaviors that seem rude and obnoxious in one culture might be perfectly normal in another. Therefore, it's not uncommon for cultural misunderstandings to arise between people of very different cultures. Frequently, just enhancing our sensitivity to these differences will reduce conflict. We're going to talk further about this. So, what are some ways to manage cultural diversity? The first step is recognizing that it exists and learning not to fear it. Remembering that everyone is the product of their own culture, and increasing both our own self-awareness and our cross-cultural awareness. There's no one certain way, but having certain attitudes can help build bridges. Admitting that you don't know something, if something seems strange to you or doesn't make any sense, starting a dialogue and suspending judgments can help. Make sure you can really understand accurately and evaluate the situation and be empathetic. In order to understand another person, we need to try to stand in their shoes. Through empathy, we can learn how other people would like to be treated by us, and we can help teach other people how we'd like to be treated. Systematically checking your assumptions, you can ask colleagues or the office for help in making sure you understand a situation clearly, and be comfortable with ambiguity. Sometimes we don't know, and sometimes we're in a situation that maybe isn't good or doesn't seem to suit us. If you're having a problem that may be related to a cultural diversity issue, please contact the office staff so that we can offer you support. I'm so grateful that we've been able to have this conversation today, and I hope you've learned a lot about the clinical policies at Synergy Home Care. I'm Nurse Corey, and it's been a pleasure. Take care and stay well.